My name's Dave McElligott, and I'm a specialist in pulmonary and critical care medicine. In my spare time, I like to spend time with my kids. I enjoy going to swim lessons with my daughter and playing catch with my son in the backyard and just watching my 8-month-old kind of grow up and start to do all those things that are so interesting for parents and strangers probably don't care about that much. I don't know if it's common, but I like to think that it's pretty rare that I knew what I wanted to do when I was in second grade. And people would ask me, what are you going to be when you grow up? And I'd say doctor, and they'd say, why? Well, because my dad's a doctor. I've come to find that I really do love being a doctor. I love being able to take care of patients and kind of follow in his footsteps in a sense. I like to work with the patients. I try to spend as much time as I can with them in the room and really make sure that they understand what's going on with their bodies and what we're doing to get to the root of the problem and fix it. You know, oftentimes at the end of visits, I've had patients say to me, I really appreciate the way you explained everything. I feel like I understand it much better now. And sometimes that can offer a lot of comfort. Just being able to put a name or a face to a disease kind of gives patients some reassurance that they're not going crazy. This isn't in their head. It's a disease, and there's something real going on, and there's something that we can do to treat that. So I always try to be sure that by the end of the visit, even if we haven't arrived at a diagnosis, the patient understands where we've been, where we are, and where we're going. I think the thing that's great about DuPage Medical Group is that it's physician-run, it's physician-driven. We all have a stake in this. We want to see it succeed. We all care very much about our jobs. We care about the people that we work with, and we care about our patients. It's not just us coming in and punching a clock and waiting for it to be 5 o'clock so we can go home and forget about everything. It's coming in early, it's staying late, it's truly being invested in the practice and wanting to see it grow and wanting to see it succeed. I think as DMG continues to grow, the benefits for the physicians are very similar to the benefits for the patient, which is as we continue to grow, we have more services to offer and we cover a wider area. So our reach is expanding, and our ability to work with other physicians using the same medical record, using the same health system, allows for a seamless transition of care from a specialist to a primary doctor and back again. It allows the communication to occur so much more easily than it would have 5 or 10 or 15 years ago. I really think that that's one of the benefits that DuPage Medical can offer.